So this is Jane, and Jane's concerned about these radiating lines coming out from the corners of her mouth. And so we're going to put a little bit of Restylane into the corners just to fill those lines out a little, and we're going to use the Artiste System, which will give us a much finer controlled injection. Well done. How was that?
Fantastic.
Good. This line is not particularly noticeable when Jane lies down, but it is quite prominent. And this is a 32 gauge needle, and the great advantage of the Artiste System is that it allows us to use ordinary Restylane through a 32 gauge needle in a very sort of controlled and steady way. And it also allows us to do either a linear threading technique or a multiple puncture technique without excessive discomfort. Does that feel okay?
Yeah. It's fantastic.
Good. And as you can see, the advantage of the Artiste enabling us to use small needles is that one gets very, very little bruising or bleeding. We've hardly seen a drop of blood so far. I think one of the other advantages of the Artiste System is that, as well as allowing one to hold the syringe in a very controlled way, it also does, because of the steady and depending on how one sets it up, slow delivery. I think it encourages a much more sort of planned and almost thoughtful technique, where you sort of build up the filler layer by layer in a much more sort of controlled way than when using manual injection techniques, where one tends to inject a little bit more quickly. Of course, you can turn the pressure on the Artiste System up in order to achieve a faster delivery in certain circumstances, but I very much like the lower settings where, as I say, with a fine needle and very little bleeding and bruising, it enables one to sort of develop the treatment of the area in a very sort of planned and progressive way without overfilling. And I think that's part of the reason why the filler seems to go further, because it reduces the tendency to give sort of large boluses in any one area. And so actually it's quite common with the Artiste to find that you've treated the area with sometimes a little bit of filler left over. I'm always very loath to waste any filler, so I tend to try and find somewhere else that the client is worrying about to inject it, but we've only used 0.2 of a mil of filler at this point, which is, as I say, evidence of the fact that one seems to be able to achieve good results with quite small quantities of filler. Well, Jane, we're all finished. I think that went very well. I think you'll find that those lines have softened nicely. And how did the treatment feel to you?
I was really impressed, actually, because I was expecting, well, I don't know what I was expecting, but there's no pain.
No.
I would say it's much easier having this done than going to the dentist.
Right, perfect. There was nothing that unpleasant that wouldn't make you come back and have it done again?
And
No.
I would suggest to people also to have it done.
Have it done, yeah. Okay, well done.